And how can we support right after post-COVID vaccination? This has become kind of a common. Now, some people are taking like the booster dose, and there is also theory that we should be taking one booster dose every 6 months. So some theories are coming up, and many people are feeling feverish, body ache, lethargy, headache, increased sleep. I mean, people are sleeping like 10 to 12 hours in a day, and body ache and respiratory distress, cough and cold has become common with the vaccines. How to approach that? What are the medicines and what are the therapies that we are thinking here?
See, what I have observed in the post-COVID vaccination, a very important disturbing trend, what I have observed is its effect on blood clotting, coagulation. And we have seen certain deaths also after the COVID vaccination. So that has to be taken care of. Whenever after a post-COVID exposure or a post-COVID vaccination, patient complains of anywhere headache, chest pain or numbness, be alert. There is a effect on blood vessels and blood. So immediately the anticoagulants and the blood thinning material should be given. So in Ayurveda, for that purpose, we need to go for all Amlarasa dravyas like Naranga or Nimbuka or even sweet lemon, and even along with that Maricha and even Tulsi. Such type of sharp drugs are used in order to break up the path so that it can run. Then clotting should not take place. So our criteria should behind this, which is alarming for us, that we need to maintain this. Particularly, it's affecting the blood vessels and blood. So that component has to be taken care of. Otherwise, all these little bit cough, cold, body ache, and these things will go off with the regular Mahasudarshana and Sudarshana Kvata and Ananda Bhairava Rasa or even Tribhuna Kirti Rasa with some medicines which can be easily manageable. The only part is that has to be taken care of. Otherwise, we have seen people with a lot of issues, and even people have died after the, even with the natural course of infection of the disease also landed in that type of troubles, and even post-COVID vaccination also people have landed in that trouble. So we should be very careful in handling those type of disease conditions.